Hello, I'm Dr. Adriana Potter, and on today's video I'm going to talk about a little bit of hypermobility disorder and EDS, which stands for Ehler-Danlos Syndrome. Many of you may not know that this diagnosis is actually quite common. Many people have some sort of hypermobility disorder. The biggest issue is that how much dysfunction that creates on a person's body. Sometimes people don't realize it, how much of the hypermobility they have it until they have decreased the activity level, and suddenly with that decrease of activity, they are losing some of the strength. And with the loss of strength, it doesn't mean like very weak, but you are not as strong as you were once. Suddenly you start having issues with your joints because those joints start moving too much because your muscles are no longer as strong as they were. Okay, so what I usually tell my patients with hypermobility in EDS, your ligaments are usually very loose, and because it's the nature of the connective disorder, the genetic disorder of the connective tissue, and you can change that. You're gonna have like that for life, but staying active and finding the right exercises will help you to try to compensate for some of this deficit that you have in that connective tissue. So the ligaments are what I describe as your static stabilizers. They don't move, right? They don't move the joint, they stabilize the joint. And they are loose, so they're not doing a good job. But your muscles, which are your dynamic stabilizers, and they move your joint, but they also can help you to hold your joint in place. You can change the strength on that by exercising. And with a patient with EDS or HSD, Hypermobility Disorder Syndrome, and usually the progression of the exercise is very slow. And the amount of exercises is not like an average person would do it. They do a lot less. Okay, but a lot of things get in the way of this people from this population from exercising, and it's important to understand which other comorbidities, which means other medical history, are on the way or getting on the way of being able to exercise and manage your symptoms. So we have a lot of issues with POTS, postural orthostatic tachycardia syndrome, gastroparesis, it would be upper gastric or lower gastric issues, mast cells activation syndrome, which stands MAX. Also, you may have cardiac issues if you have a specific type of EDS. You may have a bunch of issues with your nerves or how your organs are behaving because of the dysautonomia, which means your autonomic nervous system is not doing a good job. Also, with support of your organs, so you may have more issues with prolapse of your organs, the rectum, bladder, and uterus. So you have to make sure that you are understanding to what extent you having those comorbidities and addressing each one of them. So a physical therapist that is specialized in this population, usually they have a pelvic floor background. They don't have to have it, but usually it's best because the majority of the time they also present with some dysfunction of the bowel and bladder or the pelvic girdle. And having that specialty, I am a specialist in pelvic floor, and it has allowed me to comprehensively address all the issues from my patients with EDS that comes to my clinic. The biggest issue is finding the right provider to give you the treatment, as well finding the specialist that will treat all those other issues, a neurologist, a allergist, infection disease doctor, or a cardiologist, even orthopedic doctor. Okay, and depending on what issue you have it, you may not even know who to go look for, what words to use it, and how to summarize your medical conditions, or having a good track of your medical history. So when you go see a specialist, you can have something that organizes that your thoughts, your current symptoms and signs, and having a productive meeting with your physician, with your specialist. Having that in mind, what I did with, as I've been treating this population for about 7-8 years now, I came up with an idea to do a book, a medical history and daily reflections, because this is something that it will be going on with the patients for the rest of their lives. And the daily reflection portion of this book that I created, this diary, it helps them to be more aware of what's happening in their body, and also keep track of the things that's happening on a daily basis. They have a lot of issues with finding the pattern of the problems, and when you put it in the writing and you keep monitoring more closely, it makes it a lot easier for my patients to come up with identifying those patterns. So I have two books that I have made it. One is for a 3 months medical history. Yeah. One is for a 3 months medical history and daily reflection, and the second one is for a 6 months. They're both they have hardbound, and they also have the soft covers. Both of them are available on Amazon. The neat thing about these books, these diaries, is it helps you with the medical record. And when you're looking inside, you're gonna see some of the pages that will help you to identify those problems. So you have, from early on, just putting your general information in there, and you go on and put on the medication list. The neat thing I like about the medication list is about you having allergy or any other issues or intolerance. There's a little section on the bottom of that page that you can put in any information about your medication, and on notes on the side of the page you can actually write it down if the medication has been discontinued or there's a change on the dose that you're having it. And then it goes over medical providers. So you have a nice way to have all the medical providers, if they have the dates that you visit them. So you have all the information in there, easy to access, so you don't have to keep hunting for the information on your phone or onto your lab's report. And then the next thing that I have in the book, it is the medical diagnosis chronologically. It kind of help you to identify when you first got your first diagnosis. A lot of the patients with EDS and HSD, they are misdiagnosed. They are giving fibromyalgia issues, or as they go into meeting new specialists, they get additional diagnosis for those comorbidities that I mentioned to you. So they have any other issues like the gastroparesis, the MCAS, the allergies. So you can actually add those things or to your diary in here. And then the next session, it goes into surgical procedures, which have some information about it, and as well as the outcome for the surgery. So it kind of organizes that, and you can put it into the chronological order. And then it comes to the emergency room records. Sometimes with the POTS issue or the pain or the subluxation, all those things may lead some of the patients to go to emergency room. So there's a nice way to have a little summary of that visit into a one place to find it all. Okay. And sometimes those emergency visits will be coming into a hospitalization history, which means you stay in the hospital overnight, and there will be more tests done, and there's more spacing to those pages for you to write it down and have it available for you. The next session is my favorite one, which is the doctor's visit page. In there, you when you make an appointment for your doctor, you want to make sure that you're addressing what is pertinent to that specialist. Okay, and this page you can put the signs and symptoms that you're having it, and you may use more than one page for that. As well, you can put the questions that you're going to ask your physician. And you can write it down what you discussed with the doctor and what plans you have it, any medication and tests that he's recommending it for you to have it. So you have this nice, neat page in here. What I like about this page, it kind of helps you to organize your thoughts in your current issue and make your meeting with your physician productive. And they don't have a lot of time to go over your whole medical history, But if you have it to summarize what you're looking from them at that given session, it will make you and your physician get into an action plan that it optimizes what you needed for both of you. Okay. And then, any medical tests also has a section for you to do it, like x-rays, MRIs, lab reports, blood tests, any tilt table test, any other test that you may be doing, allergy tests, all those things in there. And the last section in the book, it is the daily health track with the reflection for that day. I always tell my patients to keep track of the food intake, whether it is amount, calorie wise, or general ideas. At least you know what you're doing. And if you're doing a tube feeding, that's a nice way for you to put it, like the rate that you're doing your tube feeding, and the kind of formula you're actually having it. If you're doing fluid intake, whether you're doing that orally or to the tube feed, and anything that you're doing for your medications, anything additional, any signs or symptoms that are specific for that day, your activity levels. We want you to move, okay? Being laying down in the bed, you're not gaining anything, you're just losing, okay? You will be in pain. We understand that with physical therapists. We understand that when you're having issues with EDS and hypermobility disorder, the pain is a biggie, okay? But not doing anything and not trying to stay strong, it will make it worse, okay? And sometimes by getting a little bit stronger, and you struggle in the beginning because you have more pain, but over time it pays forward and you feel better. Also on the daily health track, it has a to-do list, which are your goals, things you're trying to accomplish for the day, like call a physician, follow up on this, follow up with the pharmacy, make an appointment, or make sure to anything for your to-do list, and additional remarks that you might want to put it there. On the reflections, I try to be optimistic and then kind of doing a positive reflection, okay? But it can also be used for you to vent it and say, I had a sucky day or something like that. But the reflection, anything that you feel additional information that you want to add it, your feelings, things that you want to add in the reflection part of it, like, oh, I should have done this, I wish I could have done that, or anything else, and even your prayers if that's the route you want to do it. But the books are pretty much helping you to keep a track of them. What I like about the daily health track, and which will help you and your physical therapist or any other provider, is to see the pattern, okay? The overall picture. Sometimes when you look in retrospect over these pages, you may find out that you had more issues with your gut in a given day, or your symptoms were worse more in the afternoon than it was in the morning, which means that morning will be the best time for you to exercise, or you have more bowel issues after you've done X, Y, or Z type of food, or sometimes even like you have more issues with a specific medication. And so it will help you to identify patterns, I guarantee you that much. And it will help you to take more accountability for your symptoms. Some of these patients are very fortunate to have loved ones that help to take care of their health, and some don't. But in one way or the other, it is ultimately your responsibility to make the decisions and do something about your own health. So this book is intended for you to empower you with the necessary information to discuss that with your providers, with your physical therapist, your occupational therapist, your psychologist, or any other specialist for your heart, your blood flow, your circulation, your gastros, your urogynecologist, name it, okay? This is something to help you overall organizing your health, okay? I have a few patients that have used the books and they've been using for their daily health track, and they said it is very useful, and I hope you find that for yourself. I'm Dr. Adriana Potter, And today we went over on your books to help you keeping track of your medical help. Don't forget to subscribe and press the bell button to get further notifications for the videos. Have a great day.